Dentinal hypersensitivity. Contents: Introduction, Definition, Etiology, Theories, Clinical Features, and Management. Introduction. Dentinal hypersensitivity is one of the most commonly encountered clinical problems. It is clinically described as an exaggerated response to application of stimulus to expose dentine, regardless of its location. Johnson and co-workers in 1982 stated that dentinal hypersensitivity is an enigma. Definition: Dentinal hypersensitivity is defined as a short, sharp pain arising from exposed dentine in response to stimuli, typically thermal, evaporative, tactile, osmotic, or chemical, and which cannot be ascribed to any other dental defect or pathology. Etiology: Lesion localization, enamel loss, attrition, abrasion, erosion, abfraction. Lesion initiation: Require opening of dentinal tubules. Toothpaste remove the smear layer through abrasive and detergent actions. Erosive agents, particularly acid dietary fluids, readily expose tubules. Most soft drinks, some alcoholic beverages, and yogurt all readily remove the dentin smear layer after a few minutes of exposure. Theories of dentin hypersensitivity. Direction neural stimulation. Activation of initial excitation of these nerve endings in dentinal tubules. Nerve signals are conducted along the parent primary afferent nerve fibers. Dental nerve branch, brain. Gate control theory, vibration theory. Irritated pulpal nerves get activated and larger myelinated fibers accommodate these sensations, but smaller C fibers tend to be maintained, hence, high intensity gates remain open, which causes pain. Transduction theory. The theory assumed that odontoblasts extend to the periphery. Stimuli excite the process or body of the odontoblast. The membrane of the odontoblast come into close opposition with that of the nerve endings in the pulp or dentinal tubule. The odontoblast transmit the excitation of these nerve endings. Hydrodynamic theory. This theory proposes that stimuli, displacement of fluid that exists in the dentinal tubules, activates the nerve endings present in the dentin or pulp. Clinical feature. Pain is the primary symptom. The patient usually experiences a short, sharp pain in response to heat, cold, tactile stimuli, sweets, or sour foods. Intensity of pain is usually mild to moderate. The clinical symptoms of hypersensitive dentin are similar to those of acute reversible pulpitis. Tooth hypersensitivity differs from dentinal or pulpal pain. In case of dentin hypersensitivity, patient's ability to locate the source of pain is very good, whereas in pulpal pain it is very poor. The pulpal pain is explosive, intermittent, and throbbing and can be affected by heat or cold. The character of pain does not outlast the stimulus. These are the desensitizing agents used. Management: At-home self-care. Agents: potassium ions, strontium ions, fluoride ions, stannous ions, oxalates. Mechanism of action: nerve desensitization. Advantages: ease of use, convenience of self-application, easier access. Disadvantages: time consuming, may not be effective in all cases. Calcium or hydroxyapatite carriers: calcium phosphosilicate novomin, arginine calcium carbonate proarginine, nanohydroxyapatite. Mechanism of action: precipitative occlusion of dentinal tubules. Advantages: ease of use, convenience of self-application, easier access. Disadvantages: time consuming, may not be effective in all cases. In-office professional treatment. Agents: dentin bonding agents, composite resins. Mechanism of action: physical occlusion of dentinal tubules. Advantages: most effective under specific conditions, provides instant relief. Disadvantages: more invasive, iatrogenic damage if tooth preparation is involved. Fluoride varnishes, glutaraldehyde-based agents, sodium fluoride, iontophoresis, mineralization promoting cements. Mechanism of action: chemical occlusion of dentinal tubules. Advantages: most effective under specific conditions, provides instant relief. More invasive, iatrogenic damage if tooth preparation is involved. Laser therapy. Mechanism of action: photobiomodulating action, nerve desensitizing. Advantages: more effective under specific conditions, provides instant relief. Disadvantages: more invasive, iatrogenic damage if tooth preparation is involved.